All righty. Good evening, everyone, and welcome. I am Lauren Gates, your host of tonight's Airway Health Solutions Conversation Series. Tonight, I have my two partners in Airway Health and tonight's experts, Brittny Sciarra Murphy. I think that's the first time I announced you publicly like that. So welcome. And Karese Laguerre. So happy to have you both tonight. And we're discussing one of our favorite topics. It's a hot topic. We have a lot of questions, so it's going to be a really interactive evening, but orofacial myofunctional therapy. So welcome, guys. I'm so excited to be here with you tonight, and I'm more excited about all the excitement about Myo. So let's kick it off, and let's just talk about what is Myo. That was like one of the first questions. So let's just get that out of there, and then I'll dive into a little bit about your background and how you guys have become successful myofunctional therapists, and then we'll get to the questions. So who wants to jump in with what is Myo?
Well, I think we both can, because I could give more the technical term, and then I always love how Karese likens it to her analogy that she does. So if we're talking technically, it's the neuromuscular re-education or repatterning of the oral and facial muscles. But when you say that to a patient, they're going to be like, what? So in simpler terms, Karese,
I like to liken it to personal training for all the muscles below the eyes, but above the shoulders. So we're working in this range here to help, strengthen, coordinate, and really eliminate any compensatory patterns.
And although it seems new, right? It seems like almost like a new buzzword, a new hot topic. It's been going on for a long time. Do you know when about this therapy was first started?
yeah, I mean, it's been in the literature for over a century. I mean, it goes back to, Engel talking about it. The father of orthodontics. I mean, it's been in the literature. They stated how, not fixing either, the mouth breathing or the dysfunction caused from the mouth breathing can really impact stability of results.
So, when and why did you become a myofunctional therapist?
When did I? Oh,
yeah. Yeah.
Sorry,
When and why?
Clarify the question. When did I become one, and why?
Yeah.
Why for me is always based around my children. As a mother of four, I feel like a lot of things that I do is always at some way, shape, or form tied into them. So I was introduced to the concept of myofunctional therapy in 2014. I didn't actually jump in and really grab it until I found out that one of my children really just could not breathe. She had only 10% use of her nose in total. One nostril wasn't completely obstructed, the other one wasn't. And once I learned that Myo was a component that could definitely help her, and then that my other children had all these issues that I really needed to address, I dove in 2017.
Okay. And how long have you been practicing then? Yeah.
It's 2017.
Oh, so you started practicing 2017. Okay, great. I didn't know if you got trained in 2017 and then you just jumped and did it, but we'll get into that. Okay, Brittny, so why and when did you become a myofunctional therapist?
Why? Because I didn't have initially any family that got me involved with it. If anybody knows me, I'm a very passionate person, and whatever I do, it's never enough. I always have to do more. And when I read about myofunctional therapy for the first time, I needed to know what I could do to help my patients. Different things I was seeing clinically that didn't make sense to me. There has to be a reason. So I took my first course, and then of course I'm like, well, this family member, that family member, this friend. So that was in 2016. And I literally started immediately after taking my first intro course.
What would you say? We'll just go back and forth. So Karese, you're up. What was your biggest obstacle in starting your practice, and how did you overcome it?
Figuring out how to juggle everything. I started out living a double life is what I would say it was, because I started out with the support of an airway focused pediatric dentist, who I absolutely respect so much for bringing me into this field. And she wanted an in-office therapist. And so I tried to figure it out how I could make that happen. But I also had my own dreams. And so I kind of started also at the same time my own independent thing. So it was a lot of trial and error, honestly. Biggest hurdle, it was just trying to figure out how to make it all work, how to practice clinical hygiene, do in-office Myo, and do out-of-office Myo at the same time.
And so it's a lot of multitasking, it sounds like.
Yeah, that's been a theme in my life.
Yes, I think all of us, right? Brittny, why don't you share what's your biggest obstacle in starting and how you overcame it?
Yeah, I think most of us in the beginning start out balancing the hygiene life and the myofunctional therapy life. So finding the time that you're going to step away from hygiene, a lot of that is maybe if it's you work a half day with hygiene or you're seeing patients at night in the beginning. The biggest hurdle definitely for me was the lack of airway providers in Connecticut when I started back in 2016. So I would say networking. I definitely had to do networking more out of state just because I knocked on so many doors in Connecticut and I got some response, and I'm thankful to those providers, but there's a heck of a lot more buzz going on in Connecticut for Airway now.
Wonderful. And then how did you get professional referrals? This is one of the questions in our Q&A session, but I think it's good timing too. Like, you opened your practice. How did you get, that professional network?
I made a lot of new friends, and I think that's the only way to do it. Like, you have to get to know some of these people. I feel like it's such a concept that it's difficult to bring some members on board to, because they just don't understand if they were not introduced to it in medical school or in dental school. They kind of feel like it's just irrelevant. Like, if it wasn't brought up then, it doesn't need to be brought up now. And so why should I refer to you? But if you get to know them as a person, if you get to learn their practice and what their goals are, if you get to learn about, how you can collaborate, how can I help you with your patients so that you can achieve your goals better? I think that that's the best start to the relationship. So I made a lot of new friends, and, that's my story. I don't know.
Not time to be
Yeah.
shy, right?
No, definitely not. And I totally agree with Karese. I think the biggest thing is you don't want to go into an office only talking about that person referring patients to you. Like, it needs to be a two-way street. They have to see the return on investment and them making referrals to you. That's really important. Yeah, and just getting yourself out there. And I think the other good piece is to have some kind of literature to back up what you're saying, because a lot of these people are going to be literature focused, as we know, and don't want to hear so much about the clinical stories that you want to be sharing. So having that, lock and loaded, ready to give out.
Great. And there was just a question that popped up, so I'm going to go ahead and read it. Dr. Arnold says, for some of my patients where there are no myofunctional therapists nearby, they tend to go to SLPs through the school, but they are not prepping the kids for a functional frenuloplasty or even aware that the tongue tie is playing a role in the slow progress with speech. How do you suggest I assist these kids to add some additional focus in terms of myo compared to normal speech therapy?
How can you yourself assist those children? I think the optimal way, if we're going to do it like tip top on board, it would be to get somebody in your network that does teletherapy, and to have somebody who is focused on that specialty, like deal with that. I like to consider myo its own specialty. It's kind of like if you dabble in root canals, you can't do like how can I just kind of do part of a root canal on my patients? That way I don't have to refer to an endodontist because I don't have one. You never want to do it like partially. So optimally, I would just connect with somebody who does teletherapy. And there's an abundance of professionals who do.
Yeah. And
You're
I
right
would
here.
just simply explain, definitely. I would just simply explain that well, first of all, speech language pathologists don't get this training, in their graduate programs. And, they'll be the first to tell you, just like we are in our dental hygiene programs. But a lot of, especially like school-based programs, a lot of them aren't really allowed to do a lot of oral motor work. Like that's kind of like voodoo for them for whatever reason. So especially like a school-based therapist versus a private practice therapist, I mean, maybe you can get some kind of oral motor work with a private practice therapist, but they still might not know how to assess for tongue tie. I mean, I was shocked when I took my first intro course, and a lot of us are usually RDHs or SLPs. And my SLP friends that I met there, they're like, yeah, we don't look for this. We don't look under the tongue. We don't look at the swallow. And it's crazy to think, but just like we don't know what we don't know until we know it, it's the same thing for them. So I think just explaining that to parents.
Great answers. And why do you think dentists should integrate myo into their practice? I know, Karese, you were saying you had someone on board, your pediatric dentist, and it made it so much easier for you. But for those who aren't integrating it and perhaps considering it, especially if they're doing, interceptive orthodontics, myofunctional therapy appliances, expansion, why would it benefit for them to integrate myo into the dental practice?
Why it helps is that it's really going to get to the root cause of a lot of things. And that's where we want to be working on. We want to be working on root cause issues. So a lot of the soft tissue pressures of the musculature and the connective tissue that is surrounding all of our work area with all the teeth and the dental arches, it's influencing the shape of them. It's influencing the behavior of those tissues. It's influencing the pressures upon which it's exerting. If there's mouth breathing, it's drying out that oral cavity. It's giving a lot of those root cause answers. It gets addressed with myofunctional therapy. And so I would say that is like the key reason why you want to do it. You want to integrate it. That way you can have an answer for your patients instead of just like a Band-Aid.
Mhm.
And someone commented that some universities are teaching OMD and graduate programs for SLPs, which are the state universities, one of them in Kansas. So at least we're getting, So
fantastic.
thank you, Melissa, for sharing that. That's very interesting. All right, so what is the best way to start implementing Myo in the private practice? That's from Alicia. She would like to know, and I know the answer, but
The best way to start implementing like a myofunctional therapy referral or myofunctional therapy into the actual practice?
in private practice. So I guess she's a myofunctional therapist. That's her title. So the question is, and we can kind of, play off the question unless Alicia's on and wants to clarify. Her exact question is best way to start implementing Myo in private practice. So not a dental practice, I'm assuming.
Oh, like in her own myo practice. I think getting out there and networking first and foremost, like we have to have the patients coming in somehow. So, look up on the Airway Health Solutions, Airway Dentist Locator, look on, Light Scalpel's website, who's doing tongue ties in your area. There's all different directories that you can look for, make yourself a list and give yourself a goal of, either so many a week you're going to reach out to, or once a month you want to go in and do a lunch and learn somewhere. I think that is going to be the first step. If you already took your training, of course.
Right.
Yes. Assuming you did the training, I would say 100%, but you got to have somewhere for those people to go, because in this day and age, like, you network and you talk to everybody. And if you don't have a website, you kind of don't exist. If you don't have a social media presence, you kind of don't exist, right? First thing that we all do when we're referred something is we go and we Google it real quick and see how we can, find this person or learn more before we make that phone call. So set up your social media presence, set up your website. You need a website, set that up, and then get out there and market yourself.
Dr. Ko wants to know, how long does it take for someone to be trained for doing myofunctional therapy for a patient? Let's say a hygienist, or they said an assistant, but I don't believe an assistant can get trained in myofunctional therapy, correct?
Correct.
Currently, yeah. Currently,
Okay,
none of these.
so let's talk about how long it takes, because there may be a misconception here.
Yeah, I mean, that's going to depend on what intro course you take. I mean, we with Airway Health Solutions and our T-Myo course, we have two options. So we have a 2-day course that obviously it's going to be a little bit more fast-paced, jam-packed, fun-filled, interactive. We also offer an 8-week course. There's other courses out there that are 12 weeks, 14 weeks. Some I think I think the AOMT now, I think it takes like 6 months maybe to go through it. I'm not exactly sure. So that's really going to depend on, I guess, your goals, like what's going to be best for your learning style. I think that is like the biggest thing when people ask which course should I take. Look them up, look at the speakers, reach out to the speakers, learn what's their learning style. Are you able to, connect with them on some level? Because you have to be able to connect with the person that you're learning from, in my opinion. Otherwise, we kind of like shut down.
You want to add, Karese?
No, I think it can take as much or as little time as you want it to take, because there are a lot of options out there. And I like the fact that we offer the 2-day or the longer 8-week. I think it varies.
Yeah, and the 2-day is a hybrid. So you have the pre-learn modules too. It's not just, 2 days. There's self-paced learning, which I like as well. So it's kind of like a hybrid course. So kudos to you guys for doing that.
And even our 8-week course has pre-modules, just so you all know. So there's 5 pre-learn modules in our 8-week course as well.
Laura would like to know, do you recommend calling the office or going in person? I think some of the front desk team members might not relay the message or be aware about what a myofunctional therapist is or what myofunctional therapy is.
I like going in person. I think that's the very best thing. I think that if you're in dental, you kind of know the thing that I know is that we love snacks. And so I always go and I bring snacks and I'm like, look, I brought you food. And then they're more willing to like listen to me, and or you can get past the gatekeeper that way. You know, typically the gatekeeper might be the office manager or whoever's at the front office who's like, oh no, the doctor's busy, and the doctor might not actually be busy, because we've all kind of done that, right? But you come with snacks and suddenly, oh, look, hey, here's the doctor.
Okay. Anything else, Brittany, on that?
No, definitely go in person. Yeah, I mean, that's really going to be the best advice, because they might write it down and who knows, they might even throw it away. The message might never end up actually getting to the doctor.
Absolutely. And I like the food idea. Always welcome.
Oh my gosh.
So we get a lot of questions about getting certified. I know there's a lot of myths, there's a lot of confusion here. So can we just kind of spell this out here on Airway Health Solutions? The specific questions are, but you can kind of answer this however you feel is most effective, is what are your thoughts about getting certified versus just taking the training and not certifying through an organization? What are the pros and cons?
Certification is something that's just going to give you a, I guess, a little like merit in one organization's or one company's teaching protocols and course. Essentially, there's no regulatory body, there's no accrediting board, and so there's nothing that overall, due to standardization, there's nothing that overall is going to really be a certification. So you can get certified, but it, in the grand scheme of things, technically means a whole lot of nothing.
Brittany, you want to add?
Yeah, you need to clean it up.
What'd you say, Karese?
You have to clean up my answer.
No.
Great answer. I just like, I love that you're Team Maya. You get 2 perspectives. I love it.
Yeah. Well, we get this question all the time, and I love to have Karese answer it first, because people think that if they aren't certified, people aren't going to refer them patients, or like they're not going to be successful. And that's not true. I didn't become, my first certification was a COM, and I started practicing in 2016. I didn't get that until 2019, I want to say. So that's 3 years where I was practicing and people were referring me patients, and nobody ever asked me what COM meant after my name. Nobody, still to this day, nobody asks me. I have a lot of letters after my name. Then we can talk with Karese. Karese and I have both taken almost all of the same intro courses, and Karese could have taken the certifications, but she chose not to. And Karese is just as successful as I am having the certifications. So that is literally case in point, that it's not going to make you more successful or less successful. To Karese's point, so let's ask me now, why did I go and do it? So like Karese said, I took the course, I had the opportunity to take the certification. I figured, why not? To be able to have some kind of merit. Like, I put in all this hard work, like I'm going to go that extra step. So again, at the end of the day, it was just something for me to like kind of check off my list. Because it's not like being a registered dental hygienist. You don't need a certification to practice. So if you take our Team Myo course, yes, we do offer a certification, because that was something that was really important to a lot of our past graduates. But you can start practicing literally that Monday after you get back into clinic or your office or what have you.
Okay, great. Could a CDA become a myofunctional therapist?
Not currently.
Can or should?
Could.
But I don't think currently, I don't know. I don't think currently that any of the organizations that I know of that do teach currently to CDAs, RDAs, or dental assistants in any way, shape, or form. And that is absolutely no like slight to dental assistants. We love dental assistants. I survive off of dental assistants when I'm in clinical practice, but it's just no standard method of entry. And the RDH, process is a standard process. It's a licensed process. And so having that education, background, training, and standardization across the board kind of already pre-qualifies the RDH to be there in a way that the DA just isn't there yet.
Do you think tongue tie releases are being overdone?
I think that I have two answers. I think that sometimes I have come across a couple release happy providers. So I will say you want to make sure, that's why it's so important to work with a myofunctional therapist, because there has to be a functional reason to release that tethered oral tissue. First and foremost, not having that functional evaluation, you should never be releasing any kind of ties. I don't think that we're overdiagnosing them. I think that there's just more and more professionals that are competent in understanding tethered oral tissues, their impact throughout the entire body. So I really think that that's where we're seeing that increase, not so much that people are overdiagnosing and they're not there. Karese, I don't know if you have a different answer for that.
Now I feel like there are more competent providers who are looking and who are noting, and I appreciate the ones who collaborate with a functional specialist, because that's the main thing. That not everything that looks like a tie is a tie. There has to be a functional component.
Okay, and where's this question on tongue tie? How often do you guys see a need of tongue tie surgery?
Well, see, that's a loaded question, because we work with dysfunction, so we see it a lot more than I think, I don't know, than a chiropractor might see it, because we're seeing all the people who already have these issues. They're the ones who are being referred. They're the ones who are reaching out. So I see it a lot. I think that's a bulk of the people that I see, but I also don't think I'm the standard for prevalence.
Yeah, I think, and I always say this to people, and don't quote me on this, but I really do think to some degree, everybody's restricted. Like, it is so prevalent. It is so everywhere. But again, we need to know functionally, how is it impacting them? Like, if they look restricted, that doesn't mean anything if it's not actually impacting them. So we do. I mean, we see them a lot in our myofunctional therapy patients, a lot.
We had a great past conversation with Dr. Scott Siegel in our archives that you can look at. He has a whole hour on tongue ties. So that's a great video to review as well. Tina would like to know, can you provide clarity on practicing clinical hygiene and myo? It needs to be done separately, correct?
Yes, Tina. Yes.
So let's say someone wanted to integrate this into the dental practice. How would you recommend, just on an overarching recommendation, that they go about doing that? Set aside certain days for myo?
Yes,
Definitely.
absolutely. Certain days, or like a section of your schedule. So maybe in the morning you're clocked in, you're an RDH, and then in the afternoon after lunch, then you're doing myo. It's just two different sides of the brain. Jumping in and out of the schedule is like the fastest way to lead to burnout and to be an ineffective provider in both roles. And there's just nothing in the Dental State Practice Act that will, essentially allow you to use your license to do myofunctional therapy while you're clinically providing. And so it's better to just separate the two and have a separate schedule, separate login, separate payroll situation.
I was going to say definitely a separate everything.
Okay. And someone said that Laura says she read that some releases could make airway restriction worse. Do you recommend CBCT for releases if it's known that patient has an airway problem, or is it appropriate to recommend for all releases?
You definitely want to be careful. Having that CBCT would be great to know, what that existing airway is. Patients with a diagnosis of sleep apnea, the severity of their sleep apnea, you want to make sure that they have enough tongue space, because if they don't have room to put their tongue up there, and now you're releasing their tongue and giving their tongue all this new mobility, and then they go to sleep at night, that tongue is going to fall into the airway even more if we can't get it to rest up in the roof of the mouth.
Okay. And what is involved in the extra step that you mentioned earlier to become certified in Myo?
It's going to depend on the organization giving the certification. For some, it is like a live on-site and an exam. For others, it's an exam and a written component. For others, it's you have to, attend a certain number of their meetings and like do those Q&A sessions. So it's really going to vary based on, who you're getting the certification from.
Okay. And do both the 2-day and the 8-week course cover the same material as far as Myo basics and how to establish your own practice?
So the 2-day one is more geared towards the dental hygienist practicing in the dental office. And the 8-week one is geared more towards the dental hygienist that wants to get out of that app and practice myofunctional therapy privately.
Would you only refer a pediatric expansion case to a dental provider who will perform a CBCT? Is it absolutely critical, in your opinion, when searching for a collaborative dentist or orthodontist?
Would we only refer to a patient with a CB or a provider?
Yes, who perform a
CBCT?
CBCT. Is a CBCT critical when you refer to a collaborative dentist or orthodontist?
That's hard because I feel like there's not a lot of airway providers out there that don't use CBCTs.
Right.
I mean, I don't think it's like if they don't have one, I won't, refer to them or work with them, but it's definitely valuable to have. But it's just another piece of data.
Yeah. I would say it's not a deal breaker at all. And, the next step to that question is if you're only going to use providers that use CBCTs, do you accurately know how to read them? Are you reading like the report? Are you able to see the images? Do you have the same software they have so that you could view the images yourself and really do the measurements? If you're going to restrict yourself to that, I would like to think that you would be competent in the CBCT readings yourself.
Mm-hmm.
And what are the steps for your certification, the MAS certification, the Myofunctional Airway Specialist certification?
So you had to have taken one of our T-Myo courses. After that, you request the exam. You have 6 months to complete it. It consists of 100 multiple choice questions that are from the presentations, different pieces of literature that we give you throughout that. We actually also require this book. So New Trends in Myofunctional Therapy. There's some questions that are from this book. And then there is an essay, which is essentially a case study, not the case study that you use during the course, a different case study, can't be on yourself. And that is a essay format. Now, again, you only have 6 months to complete it. So when you request it, you want to keep that in mind because you have to go from beginning to end with that patient. We need you to take us through that entire patient's program.
Great. Okay. And Danielle says she's a complete newbie to the concept of Myo. Can you talk a bit about what all a myofunctional therapist does in a day, and what are you looking for, and what type of treatments do you provide?
Myo days can be interesting because it's going to be a lot of talking. You've got a lot of patient education to do. You can have consultations where you're really just telling people why they were referred and connecting the dots for them. And then they'll come for a full intake, a comprehensive intake and evaluation, where you're going to be collecting additional data. You're looking at their oral function. You're seeing where you're seeing dysfunction and problems along this oral facial region, oral pharyngeal region. And then you transfer into doing active therapy where you're doing exercises, activities, and you're trying to lead them to habituation of new neuromuscular patterns. So I would say that it's a lot of talking for a good portion of the day, all that education, and then just going through the program and teaching. It's very verbally involved. It's a lot less like hands-on as compared to clinical dentistry.
Yeah, I would say, outside of obviously that evaluation where you're doing the whole thing is pretty much education, but even in your therapy sessions, myofunctional therapy is a lot more than just giving people exercises. We have to make sure that they understand the objective behind them, the goal behind them. We don't just want to throw exercises at patients without them understanding what we're trying to, accomplish with that.
Okay, and another newbie is asking, is myofunctional therapy only for airway restrictions, or would it benefit people, patients that clench or grind their teeth?
Those Bruxers are airway patients.
Yeah.
Yay. So you kind of answered your own question. Yes, it benefits all of them. Honestly, to a certain degree, I think it benefits literally everyone. What I like to say about it is that the best part of it is that you're opening up your airway just a little bit more, because once we go down to sleep, the very first stages of sleep involve muscular relaxation. And if you think of your stomach area, if you've got six-pack abs and you lie down, there's no flab, there's nothing like going left and right. Those abs are right and they're tight and they're staying there, right? You go to lie down and you've got a beer belly and things are just all over the place, right? Like, woe is me, this is my life. So if you've got that situation and you've got that visualization, imagine that in your throat. Like, imagine having like a soft, droopy palate, or imagine not having like that tightness in the oropharyngeal region. When you go to lie down, everything just sort of flops like that beer belly. And so I think Myo really helps a little bit of everyone, because who couldn't use a little bit extra tone, you know? And so, yeah.
And to the two that said they were Myo newbies, I want you guys to think about the amount of night guards that your dental practice probably recommends on a daily basis. I am guilty of that. I totally recommended a lot of night guards in my clinical hygiene days, but I didn't know then what I know now. Every single patient that clenches and grinds their teeth, they have to be screened for airway, because I can almost bet almost my entire life that they have an airway issue.
How do they purchase the book, New Trends in Myofunctional Therapy?
You can purchase it online through the AOMT store. I think it's just AOM. I don't even know what the website is, but the AOMT Academy of Oral Facial Myofunctional Therapy.
Used to be available on Amazon. I don't know if it's back up there. Like, AOMT might be the first place to check.
Okay, great. And what does your schedule typically look like? 1 hour appointments? Are there different blocks for initial records versus a therapy session, et cetera?
So I think it also varies therapist to therapist and your level of experience. I would say in the beginning, you probably want to give yourself an hour and a half to 2 hours for an evaluation. I still block out an hour and a half in my schedule. I definitely get it done in an hour. I just like to have that half hour to type up my report, have a little break. As far as therapy sessions go, 30 minutes, 45 minutes max. I mean, it is hard to keep somebody engaged for that long. I think 30 minutes is the perfect amount. But again, in the beginning, as you're just starting, if you want that extra 15 minutes, I don't think there's anything wrong with that.
Okay. And how do you start the conversation about airway health chair side? Or how do you integrate this into a dental practice when people come in just expecting a cleaning, addressed really to all? We really love the different perspectives.
Yeah, I think that's a great question. We were talking about that a little earlier today in another forum, but I think that it is best to start slow, like ask questions. So you're going to ask them, have they ever noticed that their tongue is scalloped? Have they ever noticed that their tonsils are touching? Have they ever noticed that it's difficult for them to, keep their tongue up? Or I don't know. I would start out by mentioning little things really slowly. That kind of triggers something. A no or like a confused look is pretty much an invitation for you to say, well, we'll observe that and let's wait and watch and see. And then we'll check you again when we'll see you for your next recare appointment. A yes is a great invitation to now start, implementing a little bit of your information that you have for them, to start giving them these little tidbits that what are the associations? What does that mean that their tonsils are touching? What does that mean for their breathing, for their sleep, for their potential oral health? What's that doing to their teeth? How is that affecting the dentistry part of things? And then from there, you can really implement your own story too. I love to tell people my story of what I went through with my children and how it helped, because I think that creates that connection. And you want to have a connection with something like this. This is like a really different thing that nobody's really talking to them about. And so they have to feel like they know you, like you, and trust you enough that they can say, okay, I'm willing to take a chance and to do this thing.
Okay.
Yeah. And I think if you don't already integrate a sleep screener in your practice, I think that is definitely something that should be done. Give it with, your medical history, make sure you have sleep questions in there.
Okay. Carson had entered in that She said, my boss is a traditional dentist. Anytime patients ask about grinding, she says it's attributed to stress. I had a 9-year-old child that was grinding and I noticed her tonsils were touching and she was a mouth breather. I told the mom to go see an ENT because we don't have any functional dentists around her, but my boss told them it was stress and nothing could be done. What do you recommend doing in this situation?
It's very difficult. I don't want to tell you to go around your boss. I don't think that's, necessarily the right way. I would potentially see where I can have a sit down with my boss and to talk about the things that I know and to offer maybe resources. So different articles, peer-reviewed articles, different research that might be relevant. Ask them to attend a webinar, ask them to watch a recording of, something that has been a clear discussion on this topic. That way, maybe with the education, that will lead to different conversations. I know it's difficult in the interim to be like, don't really say anything against your boss, but sometimes we just have to just go a little extra mile.
Initiator.
Yeah.
Yeah, definitely use that as a teaching opportunity.
A pulse oximeter as part of the patient's assessment and baseline records.
Yes, we do take baseline O2 and heart rate.
And do either one of you use MyoBrace in addition to myofunctional therapy exercise with your patients? If so, does that also require a special training course?
I work collaboratively with people who use MyoBrace. I don't myself prescribe MyoBrace or keep on stock MyoBrace or hand out MyoBraces to my patients, just because the MyoBrace system is actually supposed to be used in order to help and shape and move the teeth. And that's not something that's my goal. I'm working on oral function and I have structural providers who will work on, what's going on with their teeth and the arch shape.
Yeah. I know that MyoBrace does have like a short training. If your office is doing MyoBrace, I know that they'll train you and they have their own like little series of myofunctional therapy exercises, but myofunctional therapy really needs to be individualized. I think that it's great that they're doing something, but you really should have a trained therapist that is tailoring this treatment for the patient, because not every patient will need every exercise.
And a couple of billing questions here. What are acceptable fees for comprehensive myo exams and therapy sessions?
That's going to vary based on where you're located. I know that's the worst
I feel
answer.
like that's our answer all night.
Nobody likes that. But if I was to go right now to New York City and get a job as a hygienist, I'd be making like $70 an hour, maybe even more. In South Florida and like Miami, you get like $30 an hour. Like where you're located really varies the fees as to what things cost. And so I would say to look around your area. I would even call, maybe try to see like what people are charging in your area and to stay within that same range. It's kind of like dentistry with that UCR, that usual, customary, and reasonable fee. You want to stay within the guidance of your area. So if I give you a number, that number might not work in like Tennessee, but it works, somewhere else. So I know it's a terrible answer because it's not specific and you want something like a specific answer, but it really does vary.
Yeah. I would just call local speech language pathology offices around you and, ask what their fees are. Typically, it's going to be comparable to a speech fee, and see what numbers you get.
And I bet you the ortho fees are comparable to the myo fees, right? The higher the ortho fees are in that area, probably the higher the myo fees are, because there's a range also for ortho cases as well. Catherine has a question. What's the difference between MyoBrace and Milo Aligner? I'm getting overwhelmed with all the appliances out there. Seems like patients want something tangible rather than just exercises.
Understandable. I mean, there are a lot of appliances and it's very difficult to kind of navigate it. I think the differences are very slight at best. I don't think that they're doing radically different things. I think the goal for all of them is really to facilitate a different type of positioning.
I want to say the Milo Aligner, I don't have much experience with the Milo Aligner, but I want to say it's used more in TMD cases. somebody can correct me if I'm wrong. But again, at the end of the day, that's not enough to address the underlying dysfunction. A myofunctional therapist absolutely 100% has to be involved in any kind of appliance therapy case.
Do you feel restricted what you can charge for a session compared to what a patient says their insurance will cover?
We don't accept insurance, so no.
So, right, so that makes it
And
easy.
a lot of us, as myofunctional therapists, don't accept insurance because the likelihood that insurance, they're not going to get covered. There aren't myofunctional therapy codes to be charging patients. Sometimes speech therapists can use certain speech codes and get it paid for. But as an RDH, we're very limited. You provide super bills for your patients and they can try to submit that on their own, but we can't ever guarantee. Reem can even tell you about her little story where she did try with insurance and it was a very long, tedious process to get like $25.
What do you think the pros are? What do you think the pros are in becoming a myofunctional therapist after being a clinical hygienist?
Oh my gosh, so many.
You're like finally loving your body. I mean, you're not doing all of that damage to your neck, your wrists, your back. You're actually like able to interact with patients still and see patients and use all of that knowledge that you have that you learned in school and work with patients without any of the degradation to your bones, your joints.
And I think that you're just impacting lives so much more. And we impact lives a lot as hygienists, but as myofunctional therapists, I mean, parents will like literally cry in your office, thanking you for finally listening, and they just feel heard, because a lot of parents have these gut, intuition, like this isn't right, but every provider keeps saying, oh, that's normal, they'll grow out of it. And when they finally get to somebody that actually takes the time to listen, I mean, you are truly changing families' lives, right? It impacts myofunctional disorders doesn't just impact that single person, it impacts their entire family unit.
Yeah. I would say for cons though, the con is also a pro is that you can start your own business, but being an entrepreneur is not easy by any stretch of the imagination. You're going to have like a roller coaster of experiences as you're doing that. So the pro, yay, you get to be independent. You don't have to, you don't have to work under somebody, but it's like, ooh, it's all on you. You're independent. And so, you sink or swim at your own. Your own
Right.
choice.
It is what you make it.
Yeah. Absolutely. And you have to learn to set boundaries and set goals. Those are my two biggest pieces of advice that I like literally just finally started to follow myself this year. You have to set boundaries for yourself and you have to set goals. Otherwise you'll be extremely overwhelmed 24/7.
Okay, good advice from two successful myofunctional therapists. There's just a question here about what about the myotherapy CPT code? You're saying there's a code, but they don't cover, correct? Just because there's a code doesn't mean they cover it.
So with insurance and with billing, codes can tend to be specific, right? And so there are codes that you could definitely use, but some of them are PT codes, some of them are SLP codes, some of them are occupational therapy codes, and then you wind up getting kicked back because RDH is not a part of that, or dentistry is not a part of that. And what we have to remember is that insurance at the end of the day is a business, right? So they are not in the business of covering every claim. They're in the business of saving money. Denying claims is like part of their bottom line. And so wherever they can kick it out, they'll kick it out. So there was something new implemented, but I think it is a speech code. And I think that it is something that, again, if you're in dentistry, they find a reason to knock it out, they will not reimburse or pay.
Okay. Well, those are all the questions, and great questions, everyone. Thank you so much. And thanks, guys, for great answers. I am excited to just share some updates because some of the questions were around the courses. So let's kind of review what's coming up at AHS, and we have some special announcements to make, but can you see the full screen? I just want to make sure.
Yes.
Okay, perfect. So here are the two courses that we're offering right now. If you're new to Myo, we have the integration course, 2 days, and then the Team Myo for the 8 weeks. They're both hybrid courses. It's going to be starting soon. October 19th is the first session, and then the 2-day course will be actually it's in January. So let me go to that right slide and give the right dates here. We have a flash sale. So if you're on the fence and need a sign, this is the sign. Okay. It's like nice and colorful and bright. So here's the sign. We're giving a flash sale of $200 off all our Myo courses, either the October one or the January one. It's January 13th and January 20th. And we do have a time limit on that. So here are the QR codes. We will also send the follow-up email, but take advantage of this. It never seems like a good time. Hopefully the dates will coincide. If not, we will have courses throughout the year. They usually alternate between the 8-week private Myo practice and the 2-day dental integration. So, like Brittny said, plan and have goals. And I would definitely, all hygienists, put this on your radar. What about the private practice, the Myo private practice in November was a question. You want to address that one?
I think that they're referring to coming in later.
Okay.
Right.
Gotcha. So you want to talk about that then too? Because that's an option on the website, I believe.
Yes. If you are an existing myofunctional therapist, you already took an intro course and you don't need that really basic intro as far as like foundations of myofunctional therapy, history, concepts, things like that. You can come in on week 3 now.
Three.
Right? 3. So you would start with myofunctional therapy exercises, and you would start from there. So if the week following, that's treatment planning and so forth and so on. We have it all listed on our website. So that is why if you are an experienced myofunctional therapist, technically it starts in November for you.
Great. Good answer. Terrific. All right. So there are the QR codes. We'll also does the sale include that course? Yes, it does. So we are happy to extend that as well. If it's not coming up automatically, Laura, reach out to us, or we'll make that happen tomorrow in the follow-up email. We do offer telehealth myofunctional therapy with Brittny through Airway Health Solutions. So reach out to me at info if you're interested in integrating that. And here's some big announcement, which we actually didn't announce publicly yet. So you guys kind of in the know here, is that we are now inviting all allied health professionals to the Airwaypalooza. We're opening up 50 seats due to popular demand. So many people wanted to attend because of James Nestor, because of all the knowledge being shared here. A lot of doctors wanted to bring their allied healthcare professionals with them and their team. So we do have 50 seats open, and we are also having a VIP pricing and perks here. So if you register again by September 30th, you'll get a $500 discount on a live ticket and a 3-month payment plan available. We try to make this easy for everybody. So it's $500 for 3 months. It's $1,500 for the course. $14.99, but I couldn't make that extra $1 in the payment plan. So it's $1 interest. Okay. So you're going to get a $100 discount also on the 30-day access to the recording. So we're trying to make this doable for everybody. We would love to see you there. The more the merrier. And, let's collaborate and really celebrate the airway dentists also who are kind of going down that road less traveled. This is open to pedodontists, dentists, orthodontists, myofunctional therapists, SLPs, RDHs, all the teams, CDAs, anyone who wants to learn about airway. We have 50 seats open, and these will go quickly. So please take advantage of this offer. We did try to make it easy. Oh, and Brittny, we were laughing the other night because all of the, it's open bars included, the food's included, the 2 socials. We have 2 social parties with a 5-piece jazz band, and that's why we're calling it a palooza, because it really is going to be. If you
don't know Lauren Gates, you will know her after this event, because that is why it's a palooza. She goes big, go big or go home. That is like,
yeah. So there'll be like plenty of food, plenty of drink, great music. It's going to be outside in Savannah at the Westin Golf and Spa Resort, which actually went there for my 50th birthday. Loved it and said, I'm going to have a conference here one day. So it's gorgeous. You can play golf, you can rest, you can explore Savannah, whatever you want to do. But we're going to celebrate airway dentistry and everyone who helps people breathe, sleep, thrive. And I'm really excited to see James Nestor. He's actually going to make a special keynote just for us in the airway dentistry. So I'm really excited for that. So here you can go to airwayhealthsolutions.com/APT Myo for this special. Okay, so maybe we can put that in the chat, Gerald, if you would do that, that would be terrific. And I'll also send a follow-up email. ask me any questions on that. We do have our mini residencies with Dr. Ben Moralia. I actually call him the Mr. Rogers of Airway, because he puts something that seems so complicated. He really makes it easy and simplifies it so you can integrate it into practice Monday morning. If you see our Instagram, we always post testimonials from the course, and it has the same theme where you can actually do this Monday morning, similar to how Karese and Brittny were all under the same teaching styles, that we take something complex, simplify it, and make it integratable. So if you're a dentist, an orthodontist, a pedodontist or a hygienist, SLP, myofunctional therapist who knows dentists, get them to this course, and they'll be airway dentists that you can work with to help your patients breathe, sleep, and thrive. We love having Dr. Kevin Boyd on our faculty, and he really focuses on the advanced courses of treating early childhood from under 72 months, so 3 to 6 year olds. It's an advanced course. He took Dr. Moralia's mini residency, and now he makes it a prerequisite for his course, because he learned a lot after doing this for 30 years. So that'll be live in January in Florida. And hopefully you can join us live or live stream for the advanced course. That's a doctor only course. And Dr. Moralia also has an advanced course. So for our doctors on board, again, we highly recommend the mini residency, the first one before you do the advanced, but we focus here on bracket and wires in an expansive technique, and also fixed expansion in older teens. Everyone I think knows Dr. Michael Gelb. He has a one-day mini residency getting from TMD to ortho. So he gets the patient prepared and teaches you how to do that. These are all technique courses. That's why we call them mini residencies. And then someone asked about getting on the doctor locator. You do have to take one of Dr. Moralia's mini residencies to get on the locator, because people want to know that you learned his techniques. And we're growing here. So we're really excited about all these dots, because that means we're helping thousands of people breathe, sleep, and thrive. And we actually have a global presence too. So that keeps growing. So thank you to our global friends out there. We did launch our Airway aligners to guarantee that, all aligners are different. And really, it's how you use them. And our Airway aligners have Dr. Moralia's tried and true techniques, which only focus on expansion. So you can't do any retraction. There is no IPR unless you request it for black triangles. So you're guaranteed an expansive setup that really helps your patient breathe, sleep, thrive, and helps you reduce going back and forth with the clinicians to get that expansion case that you're looking for. So you can contact Kevin about that, or contact me, but we love you to take our mini residency prior to using this, so you understand the techniques. And any of our alumni on there who hasn't signed up for our Airway Dentist Facebook group, please do, because we share a lot of cases, and we share a lot of troubleshooting, if you would, and just camaraderie. So please join if you haven't already. And those who haven't taken our courses yet, this is a public forum that you can join, our Airway Health Meetup on Facebook. So search us out. It'll be on the follow-up email to join as well. So next week, this is a big one, Airway Orthodontics with Dr. Brett Christensen. I'm so excited because any orthodontists please invite them to this, because it's peer-to-peer. Dr. Brett Christensen is an orthodontist, and he's been doing this for 30 years, and he has showing cases that show you data-driven results. So please invite all your orthodontist friends, and as well as dentists and pedodontists, to join to learn more. And then November 2nd is going to be Dr. Kevin Boyd. He's going to do early childhood case reviews. And then January 18th is Dr. Gelb demystifying TMD. And we're going to have probably other surprise guests in between there, because every time we have a conversation, you guys show up. So we really thank you for your commitment to better health and really helping your patients breathe, sleep, and thrive, because that's what makes us keep going. I love doing these. As long as you keep showing up, we'll keep showing up. And I know you guys have I think the last night of your course tonight, right? Where you do case presentations?
Yes. Yeah, we're really excited.
So that must be really rewarding to be at the last one where you see everyone grow. And now they started probably not knowing anything about Myo, right? And now they're presenting their cases. I wanted to share a little bit about how that feels.
Yeah, I mean, I think, for us, it's so nice to see them already starting to grow as confident and competent therapists, because they're taking that patient from the beginning. getting them through their evaluation, starting to treatment plan, starting to troubleshoot, making referrals. So it's something really cool for Karese and I to see. And we're always texting afterwards, like, oh my God, we're so proud of them. They did so great. And I think on the flip side for, the ladies that are going to be presenting tonight, it's so nice for them to be able to showcase their competency and for them to present, and then for us to kind of give that validation, I think is extremely helpful. And that is definitely one of my favorite weeks. I have a lot of favorite weeks in our course, but one of my very top favorite weeks of our Team Myo course.
Karese, you want to add to that? You come off mute. Yeah.
No, it's definitely a favorite. I think it's the best part of the course because you actually leave the course having started treatment planning. And so you're not leaving confused. You're not leaving not knowing what the next steps are. You're leaving having known that not only do you know the next steps, but your classmates also are very aware, and you get really great feedback, and it's an exceptional way to end a course.
Great. Well, there were a couple of questions here about the Myo book again. Can you show that? Brittany, can you hold that up for everybody? Maybe they can take a picture. Thank you.
Mm-hmm.
And then we don't have it on the calendar, but we will have another 8-week course after the October to December. And will it most likely start February, you think?
I thought that's the one that's January.
So January is the 2-day course, the other 8-week course.
Yeah, we probably would start in January or February, one of those two.
Yeah.
Okay, well, the 2 days in January, so we'll probably start the 8-week in February, right?
Yeah, that works.
Yeah, so
February
stay
1st
tuned for
on
that.
a Wednesday.
Well, as soon as we know, we will let everyone know. It'll most likely be February, though. That sounds about right. So February, March, April, and that should do it. Well, I know you guys got to run to teach your last course, and thank you guys so much for sharing all your expertise and your passion and paying it forward. We really appreciate what you do, and thanks again everyone for joining us, and we'll see you next week with Dr. Brett Christensen. Thanks everyone. Good night.